Welcome to Connect to Develop, where we bridge healthcare, strategy, and leadership insights.
Welcome back to Connect to Develop. I'm Marney, and I'm here with my wonderful co-host, Erika. Today, we're getting into a topic that's very near and dear to me, and it's one that I've been deep in for, goodness gracious, over a decade. Some context for the listeners: I've been in the education segment of healthcare for a little over 10 years. After 5 years as a surgical device sales rep, which was my entry into healthcare, I realized what I really liked best about that role was learning about new procedures, indications, products, services that my company was offering, and then being able to not only learn from others and then teach what I learned to others as I was out in my territory, even just, helping mentor informally some of the newer reps. So when I was a device rep still, I petitioned my division of the global medical industry device leader that I was at to let me really build a medical education program from the ground up. It was something that I was already doing in my day-to-day role as sales, and I felt like if there was a little bit more intentionality and focus around it, it could benefit not only our surgeons nationwide, but other reps as well. So I did that role for 4 years, and then I moved over to a patient services company that was one of the leaders in the ambulatory surgery center space. And there I had the honor of leading physician education and strategic initiatives that really revolved around outpatient total joints and spine. So the topic we're addressing today, it is a sensitive one because education and healthcare companies is really where marketing, compliance, strategy, and business development all collide.
Yeah, that's why I'm so excited we get to unpack this, Marnie, because you definitely have lived this world and just have a ton of value and context. But, at the end of the day, that's what makes this such a tough and important conversation. And so as we dive in today, we're really going to be asking, how do you measure impact of medical education and how can you direct that to revenue? If you've ever had to justify medical education budget and not have a clear ROI, you can understand that's an uphill battle. And especially when Q4 cuts or just cuts in general hit, or even new priorities are being introduced to really shift any funding or product launches.
Exactly. So let's start with the foundation. Medical education, in my mind, and I think in most clinicians' mind, it's not just a nice to have, it's really a patient safety imperative. So whether you're a med tech company, pharmaceuticals, you're a patient provider services company, if you're adopting new technologies, or even if you're a physician practice rolling out a new service line, implementing something new into the framework, training and education programs are truly what ensures safe and effective adoption and really create and maintain that culture of constant development and improvement.
It's honestly the bridge between innovation and application. And I would say that without that bridge, even the most intuitive products or seamless services can really fail to deliver a real impact. Or worse, it could compromise outcomes or introduce risk. And as you know, that's exactly why the education piece is so critical. I would add that it's not even just for compliance, but it's honestly all about, I would say, compliance and safe care.
Very much agree. And since physician and patient facing education programs can't be measured through revenue, it's often undervalued. And it's, from what I've seen, one of the first things that gets cut, which is just such a shame. So today, Eric and I really want to walk through some real world ways that you can demonstrate the impact of education programs, even though you can't point it directly to an uptick in revenue, because sometimes it's not just about showing profit to companies. And I know especially those publicly traded companies out there are doing earmuffs right now and covering their ears, but it's really about showing progress. And really, the point of running a training event or program is to create behavioral change and on the job application of whatever new is being implemented. So, these are going to be great places to start for demonstrating measurable impact. If you can capture the right pre and post training data points, you can use those to tell a much stronger story to your leadership.
Mm, that's a really good point. Let's kind of talk through the compliance piece because you and I both know that's a huge factor because in med tech and pharma, education and sales are related and do directly correlate, but they are required to be kept separate. And I remember just when I first got involved, that was something that I really had to kind of fully understand. And Even structurally, those departments often report into completely different verticals. So it's not just about who's managing who, it's really about protecting the integrity of the education itself. Education at the end of the day, when we're looking at these programs, it really needs to be unbiased. It needs to be focused on evidence-based learning, not a sales pitch. And that's why the AdvaMed and other frameworks draw a really firm line in the sand around this. If we can unpack a little bit more the compliance guardrails, especially with your background, and kind of talk through the potential KPIs that can really help track the value and effectiveness of MedEd.
Of course. So, AdvaMed's code of compliance is pretty clear, and it really states that education must be, as you just alluded to, independent from sales, which means no blending promotional messaging into the training, no offering education as a reward for either prescribing, utilizing, or purchasing something from the company. And the sales team cannot have influence over the educational content nor the faculty chosen to educate their peers or the patients. And really, this all makes sense and is reasonable since AdvaMed and other regulatory bodies were created to set guardrails for companies and for physician practices so they don't violate either the anti-kickback statute or Stark law. Now, Erika, from an operations standpoint, how would you recommend companies, if, especially if they're building something newer, set up education programs and departments to ensure that they're within compliance?
That's a really good question. I would say my recommendation is to really implement dual accountability models for med-ed teams. Education teams can collaborate cross-functionally, but they really should have independent oversight. I would also suggest building firewalls in content development workflows and reinforcing those boundaries through training, SOPs, etc. Ultimately, it's not about just the compliance, as I referenced, it's really also about that strategic clarity. And so when education is thoughtfully designed, it really earns trust. It stays compliant and still plays a really strong part in contributing to the business needs. It just takes a different route to get there, but ultimately, having those dual accountability models and just those firewalls in place are really important.
When I look back on my time in the physician development space to large healthcare companies, that's exactly how they were set up. So kudos to that. Erika, let's talk about how companies can track education program impact and metrics on how to track behavior change and on-the-job application, since that's really the two that are the most critical, especially when it's for about patient safety and care. So I am a big fan of using the 5 ways of measuring ROI on training, and it's by Kirkpatrick. And these 5 ways are number one, reaction. So did the attendee enjoy the training and were they actively engaged? Number two, learning. Did the attendee acquire any knowledge or added skill from the event or program? Then number three is behavioral change. Was there an on-the-job application that came about due to that training event, program, course, whatsoever? Number four is the results. What was the impact to the organization? So you could look at, enhanced safety, improved efficacy, higher customer satisfaction, quality improvement, etc. And number five, and they flat out state, especially when you're learning about this, number five, very, very, very few organizations actually track this because it is so finite. I mean, it comes down to incorporating the salary, HR benefits, everything into every single person that was part of creating that entire training cadence. And so, for that very reason, ROI, which is looking at the financial return compared to the cost of investment, is very rarely measured. And, you know, what's interesting is that is specifically for measuring training. It's not necessarily for measuring medical education training. I just prefer it because it's kind of the gold standard.
Well, I think all five of those are great points and great ways, but you're touching on a challenge too. I would say the last two that you mentioned specifically around the results and ROI. Marnie, you're really touching on the challenges as well to the last 2 points that you touched on, the results and ROI. The gold standard for evaluating internal training is not allowed for external medical education, even though the behavioral and clinical impact should be just as significant. So today, in the landscape of reimbursement in general, we're seeing that it's increasingly tied to outcomes, which makes this so important. Measuring education without some sort of performance lens is truly a huge miss. And I could speak to this just even from the quality background as well. It's just those outcomes are non-negotiable. At the end of the day, we're moving away from that fee for fee service model and towards more of a quality outcomes and throughput model of patient care. And I would say that without violating compliance, regulatory entities really should look at enabling some sort of KPI that can include a component of revenue. If a clinician applies what they learned and implements it through usage of a product, technology, or service, and this helps and improve patient outcomes, that really should show up somewhere. There has to be a way to measure that. And so I would say insurance companies measuring revenue and gauging the impact of strategic initiatives as they roll them out is a way to really help measure that.
Let's talk about solutions and what companies can use to measure medical education. And I personally like a mixture of KPIs. These can vary based on if it's a brand new initiative or service or program. It varies based on who the target audience is or the goals for rolling out this new education or a development program, and what headwinds, if any, the individual or team faces when building or scaling that program. And so, to start off with, I'll talk about knowledge transfer surveys. It's very critical that you get pre and post training assessments that truly test how much attendees know about the topic before or about how much they learned at the end of it. Then there's behavioral intent, or as I prefer, next steps surveys. And these are specifically phrased questions to ask how the attendees plan to change their practice or to change their work habits as a result of the training program or event. We've got clinical protocol adoption rates, and this tracks how often the new guidelines, techniques, processes, or tools that were introduced in the education session or after it as follow-ups get used in the day-to-day life. That's a huge one. If you've created an impactful experience and people feel like what you've created is helping them and they're actively engaging with the resources and tools that you provide to keep things going, huge, huge in my mind. There's patient safety metrics. This is where practices or companies can measure reductions in things like adverse events or errors or complications due to the education session. I really also love the peer-to-peer training. So these are measured with really anecdotal comments or specifically phrased questions in a survey or conversation to see, did the attendee learn something, feel like it helped them, and then did they go back and did they spread their knowledge to others? And so this is where you want to get quotes and you want to make sure that you get their permission to be able to use these quotes, especially if it's in a senior leadership roll up. Time to competency. This is a pretty, quick and most effective way for training programs that have more than one event is how quickly did the attendees reach proficiency in the topic, whether, it's once again, new product, new service, new technology being adopted. And then there's also post-training engagement with support tools. And these are, did they ask for more? Not only are they utilizing the tools, and did they start things like discussion boards or job aids? Because you can measure these, one of the things that I see that's a miss is companies getting so focused on the education and creating it and actually executing it that they don't sit down prior to even doing all of that and decide what are they going to measure, how are they going to measure it, when and how will they roll out these surveys and questionnaires. And I think one of the most critical components that's a huge miss is not meeting with leadership and the people that bless the budget, as I say, and making sure that they're aligned with these kinds of measurements and KPIs. Because once again, since we know education is one of the first things to get cut, if you don't get leadership alignment on how it's going to be a win and how you're going to measure it beforehand, how can you justify it afterwards?
I feel, Marnie, that you just laid out the success blueprint and everything you just shared. These are great for physician practices and med tech pharma companies. I would also layer in, specifically for physician practices, reduce no-show rates, faster throughput, higher service line utilization, and better patient satisfaction post-education. So those are just some things that could potentially be added as well. So, at the end of the day, if you're a leader trying to justify your medical education investment, and since we can't tie learning to sales numbers, we suggest you focus on gathering these data points and presenting it to learner-based or learning relevance, application, and impact. There's just a lot that you went through there. And I would suggest if you're in this space, anyone who's listening, kind of going back and jotting down, because you really did lay out a nice blueprint.
You can find more interviews on our YouTube channel at Marney Reid Presents.